One of the hardest things as a resident is figuring out how to best include medical students into a busy clinical service without negatively impacting all of your other responsibilities. Teaching third and fourth year students is part of your job, but how do you do it efficiently? Students do not want to make your job harder, but in order to learn, they do need your attention. Here are 7 quick tips to help you make the teaching experience more efficient and effective. As you work with students, there will be things that you find yourself repeating over and over. Perhaps there are things you say to orient new students to the floor, or schedules you describe, expectations that you outline, or even clinical content that you tend to cover with every student because it's so prevalent in your patients. Rather than taking the time to give your spiel again, write it down. Create a handout. Write a brief guide to the unit, give it to students who join the team, and let them read it on their own time or while you take care of other tasks. Create a brief study guide on a particular disease and provide it to students for them to study at home. If there are things you find yourself saying over and over again, write them down and hand them out. This will free you to complete other tasks or to provide instruction on some other aspect of patient care. It will also help you to be consistent with your instruction across medical students. You have a long list of things to do. It may be easier to get those things done and teach your med students if you partner with a fellow resident. That way, one of you can be working up a patient and the other can be observing a student's physical exam. One of you can be writing notes and the other one can be listening to a med student presentation. Then switch. With a teaching partner, you can also consider dividing up your teaching responsibilities by content. Partnering with another resident can make your teaching responsibilities feel less overwhelming and more fun. You are teaching medical students all the time, whether you realize it or not. Having students watch what you do, whether it's a procedure or a conversation with a patient's family or just writing an order, is a kind of teaching through modeling. Students are learning through observation. It's important that the medical student experience not be limited to just observation because they can only learn so much from a shadowing experience. After you have demonstrated a procedure, send your student off to practice independently. They can come back later and show you their new proficiency. But even during the most mundane of tasks, you're teaching by modeling professional attitudes and skills. Let them see and hear the best of the profession as you go about your day. Consulting a specialist, make sure students are standing close by and can hear the conversation. Writing notes, scoot over and have students watch. If having a student just sit there and watch feels a little awkward, enhance their learning experience by talking out loud. It can be powerful for medical students to hear you describe exactly what you're doing and the thinking processes behind it. By hearing you talk out loud, students gain insight into the thinking processes of an expert. They become better able to subsequently replicate that thinking process themselves and to master those skills you are demonstrating. Best of all, talking out loud does not have to take any extra time and can be done in the moment as you're completing a task. The role of instructor is one that can be shared with your learners. You can have students teach each other rather than you being the one doing all of the talking. If there is a clinical finding or disease that the team encounters, ask a student to look it up and come prepared the following day to do a short presentation on it. They can even create a handout for other members of the team. The process of researching a topic and distilling the information into a brief presentation is a great way for students to learn, and their ability to explain and teach will be another way that you can assess their knowledge base. The fact is, teaching and learning can happen anywhere: the workroom, the bedside, the ED, and, with a little discretion, hallways and the cafeteria. During inpatient pre-rounding or admitting, discuss the basics of the presumed diagnoses or necessary physical exam, then go into the room. Afterwards, recap what findings support your differential. At the computer, edit the med student note together in real time. That way they can see the changes you would make and get to ask you about specific improvements. At the bedside, ask the patient if it's okay if you teach for a minute. Talk through physical exam findings, the parts of a patient's story that lead you toward a diagnosis. In the emergency room, check out the vitals. Reinforce how to evaluate how sick or stable someone is. Discuss the immediate threats to life that need to be ruled out. On the way to lunch, use this time to answer medical student questions and clarify different processes and procedures they need to be familiar with. The instruction you provide medical students isn't meant to be exhaustive. In general, it should be practical and relevant. Think pearls and tips rather than detailed didactics, those they can get from their study materials. Unless you're tasked with giving a formal lecture to a group of medical students, your job is not necessarily to teach them medical content at the level of detail that they will encounter on their exams. That said, it can be really helpful if you identify topics that are commonly found on subject exams. Focused physical exam skills, time management tips, and good documentation techniques, all of these are rich topics for resident teaching. Much of what we've talked about here has a basis in the literature about how people learn. As part of your development as an educator, you may want to explore the medical education literature related to your teaching. You may also want to take advantage of the professional development offerings available to you through your program or institution. Thank you for your dedication to the teaching of medical students. Your role is so essential to their learning. We hope that these tips will help you incorporate students more efficiently into your clinical practice and help in your development as a medical educator.